This exercise is called the sciatic nerve floss. This is one of our favorite exercises to help tension the nerve that heads down the leg, reducing some fibrous adhesions, and it's one of the best things we can do to improve those sciatic nerve symptoms. So to begin, nerves are like ropes that start at our brain, travel down the spinal column, exit out these canals, and travel all the way down to our toes. So with these nerves, we can tension them kind of like a piece of floss. So we're going to put tension on one side of the nerve, slack on the other, and pull the nerve one way, and then tension the opposite and create slack and pull at the opposite. So it's this kind of tensioning back and forth that can really help improve patient symptoms with that sciatic nerve referral. And those will be pain that oftentimes will travel down the back side of the thigh, down into the leg, or even all the way into the foot. So in order to do this maneuver, what we're going to do is we're going to start off by tensioning everything in the lower extremity. So we're going to achieve that by flexing the hip, extending the knee, bringing my foot all the way up towards me. So right now I'm tensioning that sciatic nerve in my leg, and now I'm going to create slack on my upper half of my body. And I'm going to do that by extending my back, extending my torso, extending my neck, looking up. So now we've got slack here, tension here, and then we're going to oscillate to the other position, which will be bending the hip back, bending the knee, bending the foot. So now I'm creating as much slack as I can in my lower extremity, and then I'm going to create tension in my upper half by bending that back, bending the torso, bending the neck. Then I'm going to switch to that other position here. Up, down. Feel free to hold on to a chair that you can support yourself as you're looking up and down in case we get any dizzy spells. Good. Up and down. Up and down. Again, this is one of our favorite moves when we are having these sciatic nerve pain. And with this exercise, it's most helpful when the sciatic nerve is actually symptomatic. And when we're doing these movements, we want to pay attention to that nerve proximalizing or getting closer to the back. So if we started out with that movement and it was in our calf and now it's down to the back of our thigh, that's progression. If we start the movement and it's in our thigh and travels further down our leg, that is actually not a good sign, and that's a cue that you do not want to be performing this movement. We don't typically expect that, but we do try to give that caveat here just to make sure that we're keeping the body nice and safe. Stay tuned for some additional videos.